the Mayo Clinic introduced a new program called the National Medical School, and that includes Mayo Jacksonville with this 2+2 program.
Students admitted to this program will spend their first 2 years in Minnesota and the last 2 years in Jacksonville, Florida.
The 2+2 program will expand the learning opportunities of Mayo Medical students by offering them a new place, a different place to do their clinical studies.
Well, I think the students of the 2+2 program, what they'll really benefit from is the education that they'll get here.
This 2+2 program is an integral part of our further improvement of our Mayo Medical School education. As part of that, we are converting the Mayo Medical School into a national medical school, taking advantage of our clinical facilities in Arizona and in Florida, where we serve different diverse patient populations. Having the 3 campuses and the national presence allows the students to have experience in all areas of medicine surgery with different populations in all areas of the country, which is unique to Mayo, which no other medical school can offer.
With my medical training here in Rochester, I've had opportunities to see some really rare diseases, opportunities to talk to people who had their lives changed by having timely medical care that's well coordinated. And it's really a special thing about the Mayo Clinic. I've had very similar experiences in Florida, and I think the other half of that has been a lot of one-on-one kind of personal interaction with the clinicians because they don't have very many medical students there. And so every one of them is dedicated to making sure I get something interesting or something useful out of the rotations.
There's a very close-knit nature between the student and the faculty, and basically there's about a 13-to-1 ratio down here in Jacksonville.
I think when I'm in Florida and I've done my rotations, that's one feeling I feel when I'm here, is that it feels comfortable on several levels. I think that it's comfortable with the staff, and everyone feels very collegial.
You know, depending on whether you're here at the Mayo Jacksonville campus or over at our partnering campuses at University of Florida, Nemours, Wolfson, there's a very diverse patient population that may not necessarily occur at the other campuses.
I had the opportunity to work at University of Florida Shands Medical Center. It was a great opportunity because we got to serve many underserved minorities that have several issues that I did not really get to appreciate or get to treat before that opportunity, and really opened my eyes to the care really nationwide that populations that we need to serve.
Now, another very nice opportunity with Mayo Jacksonville is our residency and fellowship programs.
From my personal experience, I believe that my experience on the Florida campus has allowed me to make connections with clinicians, really get a feel for how the hospital works, and also to give myself the opportunity to test out some of the residency programs that they offer down there.
You know, one thing that Jacksonville really provides is the ability to have a very nice life outside the clinic, which is extremely important for balance issues. And so whether you're into the beach or swimming or more downtown type activities, there's many things to do.
It is quite nice to work very hard in a very nice location.
It's a great area of the country to develop a career and to grow.
I chose Mayo Medical School because they have a philosophy about putting the patient first, which I think is the most important thing in medicine, and probably the reason why I decided on medicine after all of my studies in science.
We have outstanding teachers at all 3 campuses that are dedicated to patient care education and research. So experiencing all 3 campuses is an opportunity that our students will have as part of this National Medical School expansion to the benefit of their education.
You should choose the 2+2 program because you get the same great education and the same interesting patient population, but you get a different environment, a different hospital, and a greater breadth of experience.
Down in Jacksonville, one of the things that you would be provided would be more of a one-on-one close-knit opportunity to interact with faculty, fellows, and residents who absolutely love to teach.
They'll not only get individual one-on-one education with consultants and fellows, but they'll also have the benefit of being in a quite nice environment to work in and to be in when you're done with work.
To a student who's interested in this 2+2 program, I would strongly encourage them to go ahead and enroll in it. I think we will personally make sure that you get a great experience with great mentorship, one-on-one teaching, and your clinical training will be simply outstanding.